Wow, that's quite the introduction. Thank you. I feel very privileged to be able to discuss the supportive care measures for myeloma with you today. I believe that it's very important because these side effects of the myeloma and the medications can impact your quality of life and then overall your adherence to the medication regimens. So the effects of myeloma. Myeloma can affect the blood counts because the myeloma cells can crowd out the normal blood cells. It can also cause decreased kidney function because you have increased level of protein in your blood, and you can also have an increased level of calcium, and it can also cause bone damage. All right, so how does myeloma cause bone damage? Well, we know from the other presentations today that the myeloma cells live in the bone marrow. They adhere to the inner lining of the bones called the bone marrow stromal cells. And what they do is they activate the cells that usually destroy bone called osteoclasts. Clasts, I remember that they chomp away at the bone. And they inhibit the osteoblasts. B for blast is what they build up the bone. So this actually is the most common side effect of myeloma when people are initially diagnosed, and it occurs in approximately 85% of the patients. And when they adhere to the inner lining of the bone, they weaken the bone and they can cause holes in the bone. Now, the calcium from the bone then goes into the bloodstream, which can cause hypercalcemia and increased calcium. And it can lead to pathologic fractures, as you can see here in the images, when it shows that the fracture was caused by the lesion, and it also points out what the lesion looks like. And then the other one is a photo of lytic lesions in the skull. So bisphosphonates can be used for myeloma bone disease. And how does it work? So in the center circle, you can see the OC, those are the osteoclasts. So those are the bone-chomping cells. And what the bisphosphonate does, that's the BP in the green there, it goes in there and inhibits the osteoclasts from destroying the bone, which then allows for the osteoblasts, or the building cells, to come in and help reduce pain and reduce the risk of fractures. So the dosing for these medications is an IV infusion, and it occurs in the doctor's office every 3 to 4 weeks. Now, the medication types that we have are Zometa, or zoldronic acid, and that is a 15-minute infusion. We also have Iridia or Pamidronate, which is a 2-hour infusion. And we put Xgeva on here, which is not a bisphosphonate, but it is a newer medication that was approved not that long ago, which is actually an injection that is given under the skin. Now, the side effects of these medications, the Zometa can reduce the kidney function. So if you do have poor kidney function, we will often schedule you for Pamidronate or the Iridia versus the Zometa. There is a risk of fracture to the femur, but that is very rare. And there is also a risk of osteonecrosis of the jaw. And after the infusions, you can experience some bone and muscle aches. Usually this does go away after 2 or 3 days, but if it continues, we want to know about it, because we've also had luck that if we extend the transfusion time from 15 minutes to maybe a half hour or an hour, the muscle aches and pains actually decreases. All right, so reducing the risk of osteonecrosis of the jaw. It is very important to complete major dental workup before beginning any bisphosphonate therapy. You also need to practice good oral hygiene, which is brushing your teeth and flossing regularly. It is also important to schedule regular dentist visits. It is important to let your doctor know if you are receiving bisphosphonate therapy, because if you do need a procedure, they may be able to schedule you for a lesser invasive procedure, which would not put you at as high of a risk of getting the osteonecrosis of the jaw. But it is very important to be attentive. So osteonecrosis of the jaw seems to be related to the amount of time that someone is on bisphosphonate therapy. There is a 3% chance of getting osteonecrosis of the jaw if you've been on Zometa for greater than 2 years. So I've seen osteonecrosis of the jaw maybe only 4 times in the 4 years that I've been working with Dr. Cole. And often people will complain of jaw pain, and you could actually see white fragment of the bone sticking out of the jaw. So it is important to also be aware of that, and if you do notice that, you need to let us know immediately. So there are 2 procedures that we can do to stabilize the spine. First is the vertebroplasty and the kyphoplasty, which are both minimally invasive procedures and can be given in or performed in an outpatient basis. What happens with the vertebroplasty is they insert cement into the vertebrae and it stabilizes it. And with the kyphoplasty, they will actually insert a balloon, inflate the balloon, and then insert the cement. So there is a potential for a rapid relief of symptoms, although the kyphoplasty can take longer. It can take about a month, so don't be discouraged if you don't get immediate relief from that procedure. So radiation therapy for pain management is also something that we may use, but we do use it judiciously because it can cause your blood counts to go down because it can affect the bone marrow. But we will often refer patients to to radiation therapy for pain management if they have an area where there's a lytic lesion or a plasmacytoma that is causing them a lot of discomfort. Sometimes it is quicker to just do the radiation therapy than to wait for the systemic therapy to kick in enough to cause relief of the pain. So this is a slide on the newly approved medication for bone loss, which is Xgeva or denosumab. And what happened is there was a phase 3 study in patients that were newly diagnosed with multiple myeloma. And they were randomized to either the Xgeva arm or the Zometa arm, and there was 859 patients in each arm. It was found that they were both equally effective in delaying the skeletal-related events, and there were fewer side effects related to kidney toxicity with Xgeva. To be honest, at the institution that I am currently employed at, we have not been writing for Xgeva unless individuals have underlying kidney-related issues, but it is available. So the effects of myeloma in low blood counts. So if you have low red blood cells, you have anemia. If you have low white blood cells, it's called neutropenia. And when you are neutropenic, you have an increased risk of getting infections. We also have low platelets, which is called thrombocytopenia. So anemia, low red blood cell count. What are the symptoms related with anemia? Well, the number one symptom is fatigue, and that is the number one symptom that I hear patients complain of every day in clinic. Anemia can also lead to depression and mood changes. It can also lead to difficulty breathing because the red blood cells carry the oxygen around to the organs in our bodies. It can cause weight loss, rapid heartbeat, dizziness, and difficulty sleeping. We'll have to say that if you are experiencing difficulty breathing, a rapid heartbeat, or dizziness, you need to call the clinic immediately. There are other causes of anemia as well, including low levels of iron, folate, and B12. Other people can have anemia of chronic disease from chronic conditions. Diabetes is one of those. So what we want to do then is we want to treat the cause of the anemia, and we need to identify it. So if it's caused from something other than myeloma, for instance, if you have iron deficiency, we would supplement with iron. You could also have a folic acid deficiency, so we would supplement with that to see if we get any improvements. There are also medications to increase the red blood cells, which we call erythropoietin or EPO. We could also turn to blood transfusions, and sometimes we need to decrease the dose or the frequency of the medication. So neutropenia is low white blood cell count. So the neutrophils are our first line of defense against infection. So for infection prevention, what we need to do is vaccine. So we would require you to have the pneumonia, and we would strongly encourage the influenza vaccine. We also may recommend treatment with IVIG, which is sometimes needed in patients that are frequently hospitalized and have an IgG level that is less than 500. Sometimes we will write for antifungal medications, antiviral prophylaxis such as acyclovir for the herpes zoster, and preventative antibiotics is also out there, but that's very controversial. And for the treatment of neutropenia, we can prescribe medications to stimulate the production of white blood cells, such as Neupogen or Granix. We can treat infections with antibiotics. We can also treat fungal infections with antifungals. And then again, sometimes we just need to decrease the dose or decrease the frequency or give a little bit of a break to allow for the neutrophils to increase back in number. So thrombocytopenia is a low platelet count. So symptoms of having a low platelet count could be easy or excessive bleeding. Superficial bleeding to the skin is something that we call petechiae. So that is little pinpoint purplish red dots that can be present. It appears to be a rash, but it is not raised, and it's more commonly found to the lower extremities or the legs. And you might notice that you have prolonged bleeding time if you were to cut yourself, and you might notice some bleeding from the gums when you brush your teeth, or you may randomly have a nosebleed. Or you could notice that there is some blood in your urine or stool, so all of which we need to know about immediately. There are other causes of thrombocytopenia. You could have a viral infection with hepatitis B or C, which in turn causes issues with your liver. You could also have immune thrombocytopenia, which could be related to lupus or rheumatoid arthritis. And there are several medications that can also cause a low platelet count, and those include heparin or sulfa-containing antibiotics, for example. There's also some anti-seizure medications out there that can also cause issues with the platelet count. So as for the treatment, we need to identify the cause, and then we need to make sure that it's not related to myeloma. We can give platelet transfusions. We might advise to hold the anticoagulation. So if you're on aspirin, we would have you hold it. If you're on warfarin, we would have to do some dosage readjustments, and then again change the dose of your medication or maybe the frequency of the medications. So myeloma can also affect the kidney, which we've already heard about earlier today. So how do we detect if it is causing issues with our kidneys? Well, you may notice that you have a decreased amount of urine production, or you may notice that your urine is darker in color. So we could also check blood tests, and we would notice an increase in creatinine or other proteins in your blood. There are other causes, though, of decreased kidney function, which include hypertension, diabetes, and then some other medications as well. So the treatment, we would have you increase your intake of water. We might also have added on an infusion of normal saline while you're in the infusion center. We would advise that you stay away from non-steroidal anti-inflammatory drugs or NSAIDs such as Aleve, Advil, or Motrin. Sometimes we may also have to rapidly remove the protein in your blood, in which we would use plasmapheresis to do so. And if there are other causes, such as hypertension and diabetes, we want to work closely with cardiology, endocrinology, your primary care doctor to ensure that all of those are under control. And then unfortunately, in some patients, especially when they're diagnosed, they may have had severe kidney damage in which they are required to be on dialysis. So that is another way, though, to help with your kidney function. So the side effects of commonly used treatments such as Velcade, and I know there's been a couple slides on this already today, but potential causes of peripheral neuropathy include the monoclonal proteins. They can also deposit on the nerve roots, so it's important that we figure out exactly what the cause is. You could also have peripheral neuropathy from previous use of Velcade, especially IV, thalidomide, or vincristine. There are some vitamin deficiencies that can also cause peripheral neuropathy. So if you initially present with peripheral neuropathy, there is a good chance that we will also add on some vitamin testing that day to your blood work. There are signs and symptoms of the peripheral neuropathy include weakness, numbness and tingling, a burning sensation, and muscle cramping that is usually bilateral or in both, either your arms or your legs. Treatment is included with treatment is proper foot care and support. We want to treat the underlying cause. We might prescribe medications, oral medications such as gabapentin, Lyrica, Cymbalta, or even some topical medications. Physical therapy has also shown to be of benefit in individuals with peripheral neuropathy. And sometimes when it is extensive, we may have to consult neurology for further evaluation and treatment options. Now, dose schedule modifications may also be necessary. So we may have to decrease the doses of medications depending upon the grade or the severity of the peripheral neuropathy, and we might have to hold the medications for a bit or decrease the frequency. The next slide is Revlimid and the symptoms that are most commonly associated with Revlimid. So fatigue, how can we combat fatigue? We need to stay active and exercise, exercise, exercise. Now, I always set realistic exercise goals. I realize that sometimes I sit down with somebody and tell them that they need to exercise, and they'll tell me, I haven't exercised in 20 years. Well, you know what? I don't want you to go on the treadmill and start running. We will start slow and try to work your way up. It is also very important to eat a healthy, well-balanced diet, high in fruits and vegetables, and try to decrease the amount of processed foods that you eat. Healthy sleep habits are also very important. Try to set a scheduled time that you will attempt to go to bed each night, which can help as well. So diarrhea. How come patients on Revlimid have diarrhea? Well, the gallbladder can release bile salts, which then can cause diarrhea. So we might want you to start taking a fiber-binding agent such as Metamucil or antidiarrheal medications such as Imodium or cholestyramine or Cholestipol. And you would want to increase your oral fluids too so you don't become dehydrated. Muscle cramps is also very common, so you can try tonic water. We also have some patients that have had success with drinking pickle juice, increase hydration, stretching, massage, and assess for any other causes, as in electrolytes, having a low calcium, and we may need to decrease the dose because of these. Also, a rash is very common, especially in the first couple cycles of Revlimid. We would recommend that you call us. If this happens, we would likely prescribe Benadryl or some over-the-counter creams, and if it's severe enough, we may refer you to dermatology. And for Kyphoplasty, common side effects are fatigue again, and you may notice you have some shortness of breath or a drop in your blood counts. The shortness of breath typically goes away within 2 to 3 days after having the infusion. Infrequently observed, but a serious side effect is heart and lung toxicities, which can sometimes be reversible and which are often reversible and manageable. It's important to keep your eye out for shortness of breath or difficulty breathing, as well as chest pain, headache, or elevated blood pressure. For treatment, we will manage your blood pressure, first off by starting with a low-sodium diet and trying to maintain good blood pressure control. We often will work with your primary care provider in order to do that. We would sometimes check your heart evaluation with an EKG in clinic or sometimes schedule an echocardiogram outside of clinic. Pulmonary function testing We may need to do some dosage reductions, and we would likely refer to cardiology if there were any issues that we were not sure how to manage. And then steroids. So steroids have many different side effects, as I'm sure you are all aware, from healthy sleep habits to noticing some puffiness in your hands or your feet, some fluctuations in your weight, irritability, sometimes even depression. So if you take, we do not want you to take the steroids on an empty stomach. If you do that, you could have heartburn. So we also want you to avoid spicy foods, avoid NSAIDs like we talked about, and try to use the enteric-coated aspirin with food. And it's also important to monitor your blood glucose level closely, especially if you are already a diabetic and are treating your diabetes. So this is, I think, the most important slide, lifestyle enhancements, which we want you to eat better. So well-balanced diet, like we said, decrease the consumption of processed foods, get more exercise, which we talked about, try to maintain a regular sleep schedule, decrease your alcohol consumption, give up tobacco, minimize or eliminate stress, and take care of your emotional and mental well-being as well as your physical health. So the cancer support community, multiple myeloma patient registry went out and surveyed 619 patients with myeloma, and they found that 81% of patients were afraid to talk about their emotional distress with their provider. So I can't even stress how important it is to let us know if you are having issues with your mental health. We can definitely find you some help and someone to talk to, including ourselves. So in summary, there's various approaches that can be used to reduce the impact of common multiple myeloma complications. We discussed bone damage and loss, low blood counts, including anemia and neutropenia, which can increase your risk of infection, as well as a reduced kidney function. So it's important that you partner with your healthcare team to determine what is the best management for you. Thank you.
I'm so proud. That was very good. That was awesome.
Thank you.
So we have one question. How long do we know that the Velcade and Kyphoplasty and having a transplant can cause shingles, and we know that the acyclovir prevents that? How long should people take acyclovir after they stop those drugs?
Usually we recommend that individuals continue to take the acyclovir for 3 to 6 months after they have taken their last dose of any of those medications.
And how about aspirin?
Aspirin, we do the same, 3 to 6 months for aspirin as well.
Very good. Well, thank you, Kenla.